I want to start with something most parents don't think about. When your child develops a skin problem, a rash, dryness, a patch that keeps coming back, the first instinct is to treat what you can see. Apply something, make it go away. And sometimes that's exactly right. But sometimes the skin is trying to tell you something. And if you only treat the surface, you miss the message entirely. Hello, I'm Dr. Sahana, a pediatric dermatologist based in Bangalore. I have been practicing pediatric dermatology for a number of years now, and one of the things that shapes how I work is this understanding. The skin is not just skin. It's the body's most visible organ, and it reflects often quite accurately what is happening on the inside. Not always, not in every case, but often enough that a trained eye looks at a child's skin and sees more than a rash. Let me explain what I mean. The skin is connected to several systems in the body in ways that show up visibly. The first is the immune system. When a child's immune system is overreacting, whether to something in the environment, food, or within the body itself, the skin is frequently where that reaction first appears. Recurrent rashes, hives, eczema, flares, these are often immune responses wearing the costume of a skin problem. The second is the gut. We now have a significant and growing body of research showing a direct relationship between gut health and skin inflammation. The gut microbiome, the ecosystem of bacteria that lives in your child's digestive system, has a direct line of communication with the immune system. When this ecosystem is disrupted, it can show up on the skin. This is why I ask parents about their child's digestion, about antibiotic history, about diet, when they come in for what seems like a straightforward skin issue. The third is nutrition. Specific nutritional deficiencies have characteristic skin signs. Low iron shows up in the pallor of the inner eyelids, in dry, dull skin that doesn't respond to moisturizer, in hair, texture changes. B12 deficiency has its own signature. So does zinc deficiency, essential fatty acid deficiency. These are not theoretical connections. They are things I look for in clinical practice. The fourth is the allergic pathway. Allergies to food, to environmental triggers, to contact substances frequently present on the skin before they're present anywhere else. A child who develops eczema before the age of 2 has a significantly higher likelihood of developing asthma and allergic rhinitis later. That is not a coincidence. It's a connected biological process that we call the atopic march. And the fifth, perhaps the most fundamental, is the skin barrier itself. So the skin has a protective outer layer that keeps moisture in and irritants out. In some children, this barrier is genetically more fragile. It lets moisture escape more easily and lets allergens and irritants in more readily. And when that barrier is compromised, the skin becomes a site of ongoing inflammation. Not because of anything the parent did wrong, but because of how that child's skin is built. Understanding this changes everything about how you manage it. Now, why does any of this matter to you as a parent? Because it changes what you look for and it changes the questions you ask. If your child has a rash that keeps coming back, the question isn't just what cream should I be using? The question is, what is the pattern? Where does it appear? When does it flare? What else is happening in this child's body at the same time? You don't need to answer these questions yourself. That's what a clinical evaluation is for. But the more you observe and the more precisely you can describe what you're seeing, the more useful information your doctor has to work with. So over the next few weeks, I'm going to walk you through 3 areas. First, what the skin can reveal about your child's overall health, the signals worth paying attention to, and what they might be connected to. Second, specific skin conditions that are more complex than they appear. Conditions that look like one thing but are another thing. Conditions where the approach to treatment matters enormously. And third, the practical daily decisions, products, routines, ingredients, what I do for my own child and why I do it. My goal is not to make you anxious about your child's skin, but it is to make you more informed, because an informed parent asks better questions, notices patterns earlier, and makes better decisions, both at home and in the clinic. Your child's skin is one of the best early warning systems you have. Over the next few weeks, I'll show you how to read it. So if you found this video useful, please like and subscribe and share it with a parent who may find this useful.